All right, let's just get more details now. Professor Tulio de Oliveira, Director of the Center for Epidemic Response and Innovation at Stellenbosch University, joins us this evening. Prof, good evening to you, and thank you so much for your time. When we see you, we breathe a sigh of relief because we know we're about to get more information on what exactly is going on here. So thank you so much for speaking to us. Firstly, let's start with the hantavirus. What do we know about it?
Okay, thank you. Yeah, we know a lot about hantavirus. Yeah, it's not a new virus like COVID. To be honest, we know about this virus for decades. Yeah, and especially in the last 5-10 years, we know of much bigger outbreaks that are happening in both Asia and in South America. So, for example, where the ship come from, that came from the south of Argentina. Argentina had in the last year had the highest number of cases of hantavirus. But we are not talking about thousands of cases. In Argentina last year they had 60 cases. With 21 deaths. So it's very likely that given that the ship sailed from Argentina, that some of the infection happened either in Argentina before entering the ship, or during the early part of the travel. However, as our health minister highlighted very well, there is not a reason to panic or to be very concerned. Hantavirus outbreaks normally can be contained. And in South Africa itself, we only know about 2 patients that came.
Mm-hmm. And Prof, when you look at the, because when you read up on it, for example, from the Center for Disease Control, for example, they say that it's a rare but potentially deadly virus transmitted primarily by rodents. And I suppose then the big question is, how do then humans get to contract the virus, and how highly transmissible is it?
Okay, thank you. So the normal way, or that most of the cases are transmitted, from rodents, more specific from the getting contact with excrement from rodents, like from or saliva or urine. A lot of time it happens, the transmission in rural settings. It happens also when people is cleaning the mess left by rats and rodents. And so that's the majority of the transmission. However, in the last 10 years, there was some small outbreaks of transmission between human to human, but that tend to be a minority of the transmissions, that happen from hantavirus.
Okay.
What we know about hantavirus, as the health minister highlighted, there is 2 main strains. One that used to be what you call in the old world that caused outbreaks in Asia, in Europe. That one has a relatively low case fatality ratio, between 1 to 15%. And then there is this what they call the new world strain, which in Argentina and South America they call the Andes virus, the variant, and that one tends to cause small outbreaks, but sometimes with a high case fatality rate, around 30%.
So how then does it present itself in terms of symptoms?
Okay, thank you. So it is quite common for viruses, that a lot of the early infections, they present like flu, very simple symptoms. And a lot of the viruses, it causes that, for example, fever, dehydration, headache, and then that start developing to further affect, the lungs, then the person started having to be hospitalized, to then be managed in a hospital, especially with hydration, but make sure that they have access to oxygen and so on. But again, we don't expect to see many cases in South Africa. Normally, the outbreak is normally involve rodents and humans. Yeah, and once detected and individuals isolated, which is the case now, and South Africa has very good isolation facilities. We deal with other pathogens like TB that's highly transmissible. Yeah, the case tend to stop transmission.
Yeah. So let's look at then the issue of the department saying that they're now conducting contact tracing. How does that work? And while you answer that, also speak to our viewers tonight about how does one, reduce the risk, if one can put it that way.
Okay, so first and mostly important, we are in a very low risk to South Africa. We have no reason to believe that this will fuel outbreaks and we're gonna see many infections. Yeah, and people, we are also in the influenza season. If people get flu symptoms, don't panic. Yeah, it is extremely unlikely to be a hantavirus, and just do as you do when you get a cold or flu. Keep hydrated, have some vitamin C, and rest. Yeah, and avoid infecting. Other. But that's for any respiratory infections. Yeah. In relationship to the contact tracing, South Africa is also very advanced on that. The NICD has very strong system for contact tracing. And what you do is just make sure that anyone that got in close contact with the people with hantavirus, that you check on them, yeah, and then you follow them in development of symptoms. Understanding that's very unusual, big outbreaks. The symptoms also, they take long to develop. Yeah, in hantavirus is between 2 to 8 weeks. Yeah, so it's not something that people will get sick very quick. But again, is no reason to concern. Yeah, at the moment, one of the reasons why the patient came to South Africa is because South Africa has very advanced testing facilities, yeah, isolation facilities, and also know how to manage well that kind of disease.
Prof, appreciate your time. Thank you so much for speaking to us and for really allaying a lot of the fears this evening. Appreciate it. That's Professor Tulio de Oliveira, Director for the Center for Epidemic Response and Innovation at Stellenbosch University. So just a reminder of some of the developments here. A spokesperson for the ship owner Oceanwide Expedition saying in a statement, a third person, a German national, has died from the virus. Now, according to the statement, the hantavirus had so far only been confirmed in the case of a British man being in South Africa, and that the ship currently anchored in front of Cape Verde was considering sailing to La Palmas and Tenerife for disembarkation.